I'll start off by performing hand hygiene, and then I'm going to introducing myself. Hi, my name is Becca. I'm a student from Marywood University, and I'm going to be your nurse today. Today we're going to be doing an ears and eye assessment. Can you please tell me your name and date of birth?
Laura Little, 11/17/72.
Okay, we're going to start with the ear assessment. So first you would start off by inspecting both ears, making sure you compare one to the other, and you want to note for size and shape and skin condition, which they both look good. And then you would palpate the external ear, remembering to do the opposite side as well. And it looks good. So then I would move on to the otoscope examination. I don't have an otoscope, but what you would do is you would make sure that you identify the tympanic membrane, and you would be looking for it to be gray and kind of a pearly color. And you would also want to identify the cone of light. So in the right ear it would be visible at 5 o'clock, and the left ear it would be visible at 7 o'clock. So there's multiple tests you can do for hearing acuity, starting with the whisper test. This tests cranial nerve number 8. So you would occlude one ear, and going out of the range of the patient's view, you would whisper a common word and have them repeat it back to you.
Banana.
Okay, and you would do the other side as well. You can also do the Rhine test. This is used to see if the patient has conductive hearing loss or sensory neuric hearing loss. The Rhine uses a tuning fork, and you would hold it at the base of the mastoid bone to test for bone occlusion, and you would ask the patient to tell you when they can no longer hear it, and then you would move it in front of the ear, and the patient should still be able to hear it, meaning that the air conduction should be greater than the bone conduction. That's the normal finding. You can also do the Weber test, which also uses a tuning fork, and you hold it at the back of their head in the center and ask if they can hear it on both ears. It should be equal on both sides. There's also the Romberg test to help test balance. So I'm going to have you stand up and place your arms straight out in front of you with your palms up and close your eyes. Okay, as you can see, there's no swaying or loss of balance, so you can go ahead and sit back down. I'll move on to the inspection of the eye. So as you can see, there's no swelling or drooping of the eyelids. The sclera is white and shiny. And for the conjunctiva, I would pull down and look at the upper ones as well. And the conjunctiva is pink and there's no drainage, so that's good. Eyes are equal and the pupils are equal as well, around size 3. So then I would check the function of cranial nerves 3, 4, and 6. And I would start by checking the nystagmus, or involuntary shaking of the eye. And I can do this by holding a pen light 12 to 14 inches away from the nose and ask the patient to follow the eyes around the 6 cardinal fields of gaze. So I'd start in the middle, and then I would go to the upper right corner, the middle, the lower right corner, the middle, the upper left corner, the middle, the lower left corner, the middle, and then left, middle, and right. So good. And then I would check for the constriction of the pupils with the pen light as well. And both constricted, and you would check for accommodation. So you would move the pen light from 12 inches away to the patient's nose as they follow it with their eye. Okay, so the patient's pupils are equal round, reacting to light, and they did accommodate. And you would test for visual acuity now, and you can have a patient read a standard size print like a newspaper or a magazine to do this. and that tests cranial nerve number 2. You can also do the Snellen chart, and you're going to have the patient stand 20 feet away from the chart and see what the lowest line they can read is. 20 out of 20 is normal. And you can also do the corneal light reflex test, and that's when you hold the pen light 12 inches away and shine the light towards the bridge of the client's nose while they are staring straight. And you want to note the light reflected on the corneas, and the reflection of the light should be in the same exact spot for each eye, which it is. This indicates parallel alignment. And you can also do the cover or uncover test. This test for strabismus. And so the client is going to cover one of their eyes and look straight ahead. And then as I remove the cover, I'm going to look at the non-covered and covered eye. And both eyes should remain at the fixed field ahead. So look straight ahead. And they both do, so that's good. And then I will go on to doing the ophthalmoscope exam, which I don't have, but you should remember to hold it in your right hand, looking at it in your right eye with the patient's right eye, and same with the left side. And with this exam, you want to visualize the right light reflex, and you should also be identifying the optic disc, the macula, and the arteries and veins, which have a ratio of 2 arteries to 3 veins.